Hello everyone. Thank you very much for being here and attending today's Polycon UK webinar. I'm very excited to introduce Yasir Khan, who's today with us. Yasir is an assistant professor in the Department of Economics at the University of Pittsburgh, and he has done fascinating work on the determinants of public sector performance and political selection. Today, he's going to talk to us about mission morale. And before I hand over to Yasir, just a few quick rules. The seminar is going to be 60 minutes. It's recorded. And if you have questions, please just feel free to unmute yourself and ask a question. There will also be the opportunity to ask more questions after the 60 minutes are over when we have turned off the recording. I would also like to briefly and already pre-announce our next webinar, which will happen on November 22nd, where we will have Javier Rivas with us. And so those are all of the rules I wanted to share. And then the screen is yours, Yasir.
Thank you very much, Andres, for the introduction. And thank you for inviting me here to present my paper. So I want to talk to you about my paper, which is on mission motivation and public sector performance. And as Andres mentioned, feel free to ask questions in like the normal seminar. Basically, the motivation for this study is that organizations, be them private, public, for-profit, they have this challenge of getting their workers to perform. And looking at the economics literature, there is now a broad kind of agreement that public sector workers specifically underperform in many low-income countries. Based on this fact that has been established by several people, there is now a sizable body of literature that tries to address this problem. And one of the main ways in which they try to address the problem is by prescribing some sort of performance-based incentives. These can be for monetary incentives, non-monetary incentives, career incentives. However, from economic theory, we understand that performance-based incentives do not always work in public sector organizations, specifically because of the multitasking problem. When workers are required to perform multiple tasks, giving them incentives on just some dimension of the task may lead to distortion in effort. Workers may improve performance on the incentivized task at the expense of the non-incentivized task. Secondly, when we think of low-income countries, developing countries, most of them have limited resources, and incentives usually require resources, which means the possibility for a low-income country to use performance-based incentives in getting their workers to improve performance is actually limited. But there is an alternative that's available to many public sector organizations, and that is the mission motivation of workers. Several economists have argued that mission helps attract workers to public sector. It works, it basically helps match the kind of workers who are motivated to perform on the type of jobs that public sector require to actually participate in these organizations. And that helps public sector organizations kind of economize on the need for providing incentives. However, largely this literature kind of stops at the selection point and basically assumes that once people are selected, they will stay motivated, their mission morale will remain high throughout, and then there's no need for an intervention. But when we look at the world around us, many organizations actually invest in signals that communicate and emphasize the role of mission to their existing workers. That kind of suggests that workers care about what their employers communicate to them. A very specific example of this was observed here in the United States in 2018, when the Environmental Protection Agency was reorganized and it decided to reorient itself. And one of the things they did while embarking on a larger reorganization was to redo their mission statement. And in that, they dropped the word science from their mission statement. That led to widespread discontent among the scientists who are actually working in the Environmental Protection Agency. And there was a mass exodus of workers who basically left the EPA, arguing that they don't agree with the general direction of the organization. This anecdote suggests that there is a huge role for what public sector organizations communicate to their workers and to their employees, and they can probably use that as a leverage to get them to exert effort on costly effort on their tasks without giving them financial incentives. And that is what I try to basically understand in this paper. I try to focus on two main questions. One is, can we get public sector workers to exert costly effort on their job by basically emphasizing the role of mission to them? And secondly, if this emphasizing mission gets them motivated about their job and they exert costly effort and improve their performance, how does that compare to that of performance-based financial incentives, which is the alternative policy that is prescribed in the literature? To do so, I run a field experiment in Pakistan with the Department of Health. I focus on their workers who are responsible for providing preventive and basic health care to rural communities. It's important to note that these workers don't sit in a facility. So these are not doctors who sit in one facility. Rather, these are workers who live in communities, rural communities, and provide them services over there. The experiment has three main interventions. The main one, which is what I call the mission sessions. In these sessions, the workers watch a video of their senior manager discussing and describing the organizational mission, which is then followed by a deliberative session in which the workers basically talk about what mission means to them, what the statement meant to them, and share their experiences. Then the second intervention is that of a financial incentive. These workers are provided a monthly performance bonus based on the number of home visits that they make. As I mentioned, that these are workers who live in rural communities and their main job is to provide services in rural communities. And one of the main things in which they do is by visiting households every month. So that's the margin on which they are given financial incentive. And then the third intervention is a combination of the two, that is workers participate in these mission sessions and also receive financial incentives. To study how these interventions affect their performance, I rely on a number of data sources and look at a number of measures of performance. So first is the main measure of performance is household visits, which is like, are these workers actually going to households in their community and providing them services or not? But while performing those visits, they also are supposed to perform multiple tasks, which I'm going to describe in somewhat more detail in a few slides. So to capture this information, I do a household survey, send my my independent survey teams to ask the households whether the workers visited them and what kind of tasks did they perform. I supplement this information with health outcomes using household survey and administrative data. And finally, I also implement a lab in the field activity to get at what could be the possible mechanisms behind the behavior change that I observe. What I find, so in summary, basically what I find is that emphasizing the mission actually gets workers more motivated and they improve their performance on the job. And with this, I kind of contribute to this literature on state capabilities, which is concerned with the idea of improving the performance of public sector workers in low-income countries that can improve the capacity of the state to provide these such public services. However, as I mentioned earlier, much of this literature is focused on changing either incentives or selection of workers. What my paper contributes is by show that basically keeping the selection the status quo in selection, we can still get workers to improve their performance and improve the delivery of public services without giving them financial incentives, but rather focusing on their mission motivation. The second literature this paper relates to is that of personnel economics. There is, as I mentioned, there's a large body of literature that argues that providing incentives in a multitasking environment can backfire. But what I show here is that with the mission, actually, the work organizations can limit the potential for these distortions that can emerge because of the workers being required to perform multiple tasks. More importantly, I show that workers improve their performance not just on tasks that can be easily measured, but also on tasks that are difficult to measure for a public sector organization. Thirdly, the paper relates to the literature on managerial practices, which argues, which highlights the role of managers for the way in which organizations deliver services and organization performs. And the literature largely argues that basically those organizations that that adopt good management practices, such as having clear targets, delegation of duties, having clearly outlined job descriptions, basically will mean that an organization will perform well. My paper contributes to this literature, but by arguing that there's also a role for a very clear managerial communication about the larger purpose or mission of the organization. Lastly, the paper relates to the motivation crowd out literature, which argues that providing incentives can lead to crowding out of intrinsic motivations. And I show that mission does, the motivation, at least in this setting, does not get crowded out. So there is a subtle interesting result, which basically shows that the financial incentives kind of become less effective. And I'm going to argue that this is because of the multitasking nature of the job. So at this stage, before I move forward, if there are any questions, please feel free to ask. Otherwise, I'm going to tell you the details. Yeah.
Just a bit, I don't know if this is the right place to ask this about this word mission, because this suggests it's a benevolent task in the public sector. This is your example, but it seems like it could be generalized and it doesn't have to be necessarily benevolent. So if I imagine some kind of a group of a militant group that tries to, I don't know, maybe a government tries to do something bad, but instead of incentives, use. Is that generalizable, or is?
Yes, I think of it as a generalizable. I hadn't thought of armed group basically. And its relationship to violence, but that is very much true. It's kind of related to this idea of the identity of people. So if an armed group has this identity, which has a clear connection to a mission of, let's say, I don't know, establishing a state or imparting some violent act on certain other people, then it definitely is generalizable to that setting. One way in which I think of the generalizability is when I look at the for-profit sector. So you would think that for-profit mission shouldn't be relevant to for-profit sector if it only works when it's benevolent, but that's not the case, because all these large corporations actually do invest in signals that kind of communicate to their workers their larger mission. And one example, when I think last year or a year and a half ago, when this came out from Facebook, when Facebook was really in the limelight in media, a lot of people, there were these articles which talked about Facebook employees actually leaving the organization because they thought Facebook has strayed from its mission of connecting people and gone into this other, I don't know, has focused more on making money, even though the organization was always focused on making money. It's just that those aspects of it came to light, which people did not agree with, and they decided to leave the organization. So in a short, yes, I think it's more generalizable. But in this paper and in this presentation, I'm going to focus on the benevolent aspect of it, which is related to the public sector.
Can I also ask a question?
Sure.
So I can think of missions that are easier to get people excited about than others, right? So if you're in health or in education, it's probably kind of easier than if you're a tax collector, I suppose. I mean, if you collect taxes, it's harder to see what you're doing as well. Is there going to be anything about that here? Because I suspect you're going to focus on a sector and so on. But to me, that would be an interesting comparative static in a way, right? So we should expect that to be the case. Everything else being
that's definitely a very important point, and I think that definitely could be an interesting thing to look at. In this context, I'm unfortunately not going to focus on on that aspect. I'm just going to focus on the organization where it's relatively easier to motivate people. People have sort of probably self-selected into working for this organization because they already had some understanding or some idea about this mission. So let me give you the background of where I do my experiment. As I said, I work in Pakistan with the community health workers. I work in one district, which is Haripur, but largely in Pakistan, the community health workers are kind of the backbone of the public health system. There are about 130,000 such workers, and each worker operates in one rural community in a clearly delineated geographical location. They are the main service providers in many far-flung rural areas. Importantly, they are all women. So in my context, this is kind of a limitation of this context as well, that I'm not going to be able to see any heterogeneity on gender, let's say, because the workforce is all women. There are no men involved because of the nature of the job and the nature of the society. They are loosely attached to a facility, so they report to a clinic once in a while, collect their stash of medicine, submit their paperwork, but they generally operate independently out of their homes in their communities. On average, they're responsible for 156 households. They do not have any geographical overlap between their areas of responsibilities, which makes this experiment possible, because that means there is very little scope for interaction between them. Their senior manager is a district health officer. So the workers basically, of course, have supervisors and all, but at the top of all of them is a district health officer who leads the health machinery of the whole district. These are outreach workers primarily. So they focus on so their main job is to basically go to the households and work on the preventive and basic healthcare needs of the households. They're not supposed to sit in a clinic where the people get to come to them after they get sick. Instead, they are supposed to reach out to those households and keep a tab on them, which means that it is required of them to visit households in their community every month to make sure that they are aware of what is going on there, what are the health needs of the children, of the mothers in those households. They have a job description, and in that job description, their core duties are, as I said, like basically visiting households. If there is pregnant women, provide them antenatal care. If there are children, keep track of their health. And then impart general health literacy to those households. But on top of that, from time to time, the department also gives them these additional tasks, additional duties, which are not part of their original job description, but this is something that the department asks them to do. And I focused on, I collect information on two such duties. One is tuberculosis screening. So basically they go to household, they perform a simple screen, ask the respondent, is there anyone who has been coughing in this household? Has that cough been there for more than 3 weeks? Basically look for suspected case of tuberculosis and then refer those people to the clinics where they can actually be treated. In addition, they also organize immunization camps. So the department has dedicated immunization staff to vaccinate children against I think 10 or so different diseases, from the time they are born to the age 2. But to help those staff, what these workers do is that they organize these camps in the community, so that instead of the parents needing to take their children to the clinics where those staff are based, they basically organize a sort of a mini clinic in their community, so that to reduce the cost of transportation and time for the parents. And I'm going to focus on these other additional duties as well in the context of multitask. In status quo, there is very little monitoring that goes on of their job. They record a lot of information, but all of it is on paper, so it's very difficult to verify. A lot of it could be made up. They get a fixed salary every month. At the time when I was doing this experiment, their fixed salary was 17,500 rupees a month. And they don't have any career prospects. So basically, unless they invest in retooling themselves, doing a certification or a diploma of nursing, they cannot go up in the higher up in the organization. And that also, just doing a diploma does not mean that they can move up the ladder. It only, if the government is hiring nurses, then they can probably apply to those positions like everyone else and can move up. But in the status quo, they don't really have any prospect of promotion to higher tier or higher level. So now I'm going to explain to you what the different treatments were in this experiment. As I mentioned, the main.
Sorry.
Sure. Yeah. Go ahead.
And these workers, what's the recruitment into that position? Because you said there are no prospects for them to exit, but how are they recruited?
So basically, the recruitment is done like any. I shouldn't say any, but like an average government department. In Pakistan, that means that the department puts an ad in the newspapers saying that they have vacancies for like 200 or 300. Usually they were recruited in like mass recruitment campaigns. So they say there are 200, 300 vacancies available, and they have a list of communities in which the vacancies are available, and people, if they are interested, they have a eligibility criteria for women, they ask them to apply. So I have a picture of the ad, which I didn't include in this presentation, but like it's a very generic kind of recruitment, which is generally like the government has a standard and they just follow that.
But this is a government job, so I don't know not lucrative, maybe the wrong word, but you know, how desirable is this kind of, you know, this 17,000
It is definitely desirable because at the time of hiring, their skills, basically the eligibility criteria is like you have to have just like a middle school or high school, and that's pretty much it. So you don't really have any health skill. After you get hired, then you go through a certification program, which is like a 3-month-long certification. So they get tooled up. So at the time of hiring, it's definitely a lucrative job. During, like after you gain experience and all, then of course a question can arise whether outside options are better or not. But at the time of hiring, it's a lucrative job. Yes.
Thanks.
I have a related question.
Yep.
So if there are no career incentives, how long do people stay in the job?
Very long. So basically nobody leaves the job pretty much, and nobody gets fired either. So I've been working with community health workers for almost a decade, and I think probably I know only one instance of somebody getting fired. So nobody leaves the job, nobody basically gets fired. Unless the person moves out of the district, then they leave the job. But if they don't need to move, then it's pretty much a long-term job. So the first treatment that I have, and the main treatment I have, is that of a mission. So what I do is that before we start the experiment, we go to the district health officer, who's our partner in this experiment. Basically, his department is implementing it. And we record a very short 1-minute video of the district health officer talking about the organizational mission. And in the video, he addresses these community health workers. They are called lady health workers, or LHWs in the local language. So basically, in the video, he tells them that I want to give the LHWs a message about the program's mission. And the mission is to ensure that no mother or child is left without basic health services. And every mother should have the basic knowledge about her own health and that of her child. So after we record this video, the department then invites the workers, of course, randomly selected workers, to these mission sessions. And what these mission sessions have is that there are about like 10 to 20, depending on the kind of area, workers, they get together in this one facility. We start this session by first showing them the video of the DHO, the senior manager of the department, in which he discusses and describes the mission. Then we have a facilitator at hand who opens the session to discussions. and invites workers to share their thoughts, concerns, and experiences. The whole idea is that the facilitator role is there basically to ask questions and to encourage these workers to talk about the mission. So that basically we want them to kind of take ownership of this discussion and to feel that this is something that is kind of important for the organization, and it's not something that an outsider is coming and telling them about.
I have a couple of questions about this.
Yes.
So the first one is, so how, so I suppose, well, when you describe the control group, but how is it to disentangle the effect of branding the mission versus a team building exercise? Because people are just meeting.
I have a placebo.
Okay.
In which there is no mission discussion. I'm going to show it to you in 2 slides.
And also the other question I had is how often, because there's a little bit of like a corporate parlance here in talking about the mission, and this can be exciting sometimes, but when you have an overload of corporate parlance, like in a British higher education institution, it can backfire, right? So it can get really, really boring. So, you know, what would be the context here? How aware are people of these missions? How often are they talked about? All these things.
So that's an interesting question. So there are 2 parts to it. One is like how often are they kind of like called up to these kind of sessions, not specifically mission. That is kind of, they are pretty much aware of it, because like every few months some or donor organization, Gates Foundation, Wealth Health Organization, basically they organize these kind of like sessions, which are this build a skills refresher training program. And this was also built as a skills refresher training session to these workers. In that, I asked the workers in the baseline, very few people actually report that anyone has ever talked to them about the organizational mission. So that aspect is clearly unique. The idea of getting together and talking about something, that's not unique. So what I do is that I basically limit the session to be a few hours. Let me just tell you that, like the whole session runs from 3 to 4 hours. Once a month for 3 months. And these 3 to 4 hours mean that it's not just focused on the mission, but rather after there is all this discussion of the mission, the facilitator then talks about, imparts a skills refresher training to them. So the larger part of the interventions also kind of constitute just talking about the basic skills that these workers need to go and discharge their duties. So I try to balance it by making sure that it's not a one-off thing, because that would also then mean that the workers will not take it seriously. They may think, oh, this is a one-off thing, like nobody is going to take it seriously, so they may not respond to it. But you're right, I also did not want it to backfire. So at least in the 3-month period that I run it for, there is no evidence of backfiring. But I take your comment that maybe or longer run it probably can backfire. I just don't know.
Also, I've got a quick question on, so you said this is selected randomly. So can you explain a bit more, like how these people get selected into these events? Maybe they are invited randomly, but then those who attend, that's not super random. Those are the most curious ones who attend the session. Can you say a bit more about that?
Yeah, so I do the randomization. So I had the list of people and the facilities that they were attached to, and I randomized them and blocked the randomization on the mother facility that they were attached to. There is nearly 100% compliance. Almost everyone attends, except for a few cases when people were sick, at least where they basically had to miss the sessions. But otherwise, the compliance is pretty much 100%. Because it was built to them. It's important to note that it wasn't me inviting them. This was kind of like the official organization organizing these things for them. So for them, it was just part of their job to go and to come to these sessions.
But this invitation from the organization, that's so how do they decide who gets invited? Like
I do the randomization. Yes.
And okay.
Yes, I gave them a list of people who needs to be invited to these sessions. So these sessions run for 3 months. Every month I have, Andreas.
Sorry, can I ask a question about the message that the DHO read out? Is that something that he wrote himself, or did you write this? And so I wondered, in a sense, is there So if like a particular credibility issue is like, is this a particular, successful DHO or someone who's like particularly inspiring? Or how did this come about?
Yes, that's a good question. We kind of wrote it together. So I wrote it, but like the DHO had inputs because it was him who was going to give this message. So he had to be comfortable giving the message. So it was kind of like a joint effort to write, because we had to write it out concisely and like make sure the video is not very long, because we did not want people to kind of like switch off.
Thank you.
So as I said, each of these session also includes a skills refresher training, which is focused on mother and child health. And we follow a case study kind of a method. So the facilitator describes a scenario to them and asks questions like, okay, so what do you do in this setting? And what's the correct way of doing that? These are very focused on very basic things like how to treat diarrhea and stuff, which are the kind of things that these workers need to know for discharging their job. And most of them already know. The skills refresher is important because then it means that I can include a placebo treatment, which I'm going to show you, and which kind of mimics the mission sessions without talking about the mission. It also makes sure that the treatment doesn't look out of place, because the workers are kind of used to these kind of skills refresher training sessions. The second treatment is that of financial incentives. So basically, the workers receive a call from the DHO office telling them that they are being offered a financial incentive. They can earn 20 rupees for each additional household that they visit during the month. We had to cap the incentive at 500 rupees a month because of the financial constraints. But anyone who visits about 20 additional households or visits everyone in their community gets 500 rupees a month. And this constitutes about 2.9% of their monthly salary. Importantly, the payments and everything is done in private. So there is no public aspect to the financial incentives part. Then, so as I mentioned, the third intervention is a combination of the two. So we have a group of workers who participate in the mission sessions, and they also receive financial incentives. But it's important to note that there is no discussion of the financial incentives within these group sessions. So just like the pure financial incentive treatment, these workers are called on the phone and informed about the financial incentive part of it. I have a placebo group as well, where the workers meet in the same frequency as the mission treatment, where they receive the same skills refresher training with the facilitator. There is no discussion of organizational mission. That's basically to help address Valeria's question of like, is there like a team building aspect to it or not? And then there's a pure control where business as usual. We don't invite or offer any financial incentive to these workers.
Also, what about is there a possibility of workers meeting outside the session between themselves? So let's say one of the worker gets to know that the other worker is getting the incentive and they are not. Like, is how big?
Yeah. So so basically, these workers they work in their own very distinct community. So there's very little geographical overlap. The only time they meet is when they come for these kind of sessions to the facility. And that's where this interaction can potentially happen. But given that I don't really find any evidence for this kind of a spillover in this setting, because there's very little interaction between workers outside these kind of sessions. So I individually randomize workers into these different treatment conditions. The randomization is blocked at the facility level. I work with 710 community health workers. Now, measuring performance is actually a massive part of this project and this paper, because I did not want to rely on the self-report of performance. So what I instead did was that I hired survey teams. These are all women as well, just keeping with the cultural norm. And I sent them out to the communities of these workers. And we surveyed about 7,100 households every month during the 3 months that the treatment was running. And 1 month after the treatment had ended. These household surveys were very short, like in very basic. We asked them, did the worker visit you during the previous calendar month? If they say yes, we collect information on what kind of major activities they did during this visit. Then we supplement this information with a baseline and endline survey of the workers. And 1 year after the experiment, I do an incentivized lab in the field activity. I also collect some administrative data, which I use for the health outcomes part. The experiment ran for 3 months, basically starting in February 2019. While the treatments were running, as I said, we also collected information in parallel on their performance. The lab in the field experiment happened in April 2020. And randomization was balanced across covariates. I can show you the table if you're interested, but given that I have about 23 minutes, I want to move into the results part. So basically, the main estimation equation that I'm going to run is linear probability model. The dependent variable is a dummy. So in the main result that I'm working to focus on is that of a household visit, so the dummy takes a value of 1 if household I is visited by worker J in block P in a given month T. I include randomization block and month survey month fixed effects. I also include baseline performance. I control for that, though I can remove that, and there is actually very little effect of it. Importantly, in the results that I'm going to show you, I include the separate dummy for each main treatment condition. So mission is a separate dummy, financial incentive is a separate dummy, and mission financial incentive is a separate dummy. So when you look at the effect of mission and financial, you don't have to do subtraction addition with other coefficients. You can just interpret that coefficient straight away. The left out group is always the pure control. So the main result that we are interested in, and the Department of Health was also interested in, is that of like, does this do anything to the probability of home visits? That is, do these workers actually visit households or not? Before we get into the effects, the control mean is about 35%. So even though on paper, these workers should be visiting 100% of the households in their community, that is not the case. They have a lot of slack, at least when we take the policy as a benchmark. So what I find here, so I'm going to plot the coefficients on this graph. So on the y-axis is the effect on the probability of household visit, and the x-axis is different treatment conditions. So what I find first is that workers who participated in these mission sessions, they improve their performance, and they increase the probability of a household visit by about 0.5 percentage points. This roughly translates into about, I think, 9 additional household visits that these workers perform after participating in these mission sessions. Now, as we kind of hinted at earlier, the mission session was not just mission, but also it was, there could be possibility of learning from each other, learning from the facilitator and all. So I look at the placebo group as well, and I find that the placebo group is actually no effect, almost zero effect of just meeting and getting the refresher training. So all the effect on the mission session could be, is probably driven by the effect of the mission treatment. In comparison, when I look at the financial incentive group, and remember, these are the people who receive financial incentives for visiting households, that also improves performance, and substantially by about 9 percentage points. This translates to about 16 additional household visits. These workers basically were getting paid more, so naturally they improve their performance by visiting more households to increase their take-home pay. Now, looking at the workers who receive both mission and financial incentives, they also improve. This treatment also improved performance. However, there are some interesting patterns. The improvement is almost the same as that of a mission, though the point estimate is slightly higher, but it's substantially lower than the financial incentives. So the workers who were offered just the financial incentives, they visited about 16 additional households, but workers who received both treatments visited about 11 additional households. This kind of suggests, so I interpret this into, there are two interesting results that I take from this. One, I don't see an evidence of crowding out of motivation. And I say this based on my definition of crowding out of motivation. If there is crowding out of motivation, then this effect should have been negative. The workers should have reduced their performance, but I don't see that. But it seems like the financial incentive is losing its efficacy. So when you give financial incentives alone, it gets workers to perform way better than when you give the financial incentives along with the mission treatment. Workers are sort of leaving money on the table here, or if this is the only graph you look at, that's one interpretation you may take from it, is that workers are leaving money on the table. However, I'm going to show it to you, and I'm going to argue that this behavior is basically the result of the multitasking nature of the job. Workers perform multiple tasks. Financial incentives focus on just one aspect of the task, whereas mission could potentially motivate them to improve performance on all aspects of the task.
Sorry, I have a quick question.
Sure.
Would it make sense here to also look at the difference between mission and placebo? So that would be the net effect of everyone who's gone to the training. What is the net effect of having that motivation, that mission statement?
Yes, so I mean, I do that, and I find this is with respect to placebo, and the effects are still significant. The mission treatment workers still kind of like the mission effect is still pretty strong and gets workers to visit more households.
Okay, thanks.
Yeah. So basically, as I argued, this was probably because of the results of multiple tasks that these workers perform. And that's what I want to see, whether there is any evidence for that. And so in the beginning, I mentioned to you, there are two types of tasks, the core tasks and the additional tasks. So I collect information on all these different types, 5 types of tasks. So once the worker visit a household, we collect information on if there is a pregnant woman in the household, do they perform antenatal checks? If there are children in the household, do they check the health of the child by taking their weight, checking for signs of anemia, and other things? Then we ask the households, do these workers actually discuss with you different disease prevention and health literacy points? We collect information on that. So these are the core tasks. Then in addition, we also ask the household, did they screen you for tuberculosis? And we ask, did they ask you about, like, was anyone coughing in the household or not? And lastly, we collect information on how many immunization camps were organized in these communities. And so I combine all these different measures of different tasks in a non-incentivized task index, which is what I'm going to show to you now. And like before, I'm going to plot the coefficient. So these are in standardized. So the coefficient on the numbers on the y-axis is basically on the standard deviation terms. And what I find is that mission actually motivated workers to improve performance on these multiple tasks, which are usually sometimes difficult to measure and difficult to contract on. So workers who participate in the mission sessions basically became motivated about their job overall and not just focused on the headline job, which was visiting more households. And this effect is about 0.17 standard deviation. Not surprisingly, when I look at the financial incentives group, there is no effect on the multiple tasks index. I don't see a backfiring. So this classic Milgram-Shannon result that there may be a trade-off between efforts moving from the incentivized to a non-incentivized. I don't find an evidence for that, but I don't find workers improving performance on these non-incentivized tasks either, which is not surprising because they were not getting paid to do these other things more. Importantly, the workers who participated both the mission sessions and receive financial incentives actually also improve performance on these multiple tasks. Now, if you take the previous graph and this graph together, what it shows you is that the earlier decline in the home visits that you saw relative to pure financial incentives was because these workers are actually exerting effort not just on visiting households, which is what the financial incentives were making them do, but also performing these other tasks. And they were kind of optimizing in spreading their time across these other activities. which is why we saw this drop in performance and we between the financial and the combined treatment group. So with these few results, I hope to have convinced you that mission actually is a strong motivator, and public sector organizations can get them to get workers to improve performance, not just on easily measurable and contractable tasks, but also on an array of multiple tasks. Some of them may not be very easily contractable and measurable or cost effectively measurable. Now
Yes,
I want to
Yasir?
move. Yes, yes.
Sorry, so just a quick question out of curiosity. Can you look at these effects over time, sort of as you build sort of like this panel of observations?
Yes, so some of them I can look over time. So for example, antenatal checks and household literacy discussion. I don't have the result here, but like they pretty much like emerge and stay consistent through the experiment. I can't look at the immunization camps over time because I collect this information only once. So that is one which I can't, but others I can. And I think there is, I don't have a table, but I think there is like a consistently positive effect.
Thank you.
Also, can you, based on this, can you say something about the combined effect of the incentivized and the non-incentivized tasks, like whether mission is enough or whether mission plus financial is less?
No, so what I find is that the mission alone is enough. I don't know how much time I can show you the table here. The mission, so this is basically in the columns are different types of the kind of like the elements that went into these index, and the mission improves performance on all three core tasks. So basically, and they perform more antenatal checks, they examine children more, they discuss disease prevention more. Financial and mission combined is still positive and significant, though I ran into power issues, so it's kind of like difficult to catch it on all. But mission alone, to answer your question, is enough. You don't have to combine it with the financial incentive to get them to work on these multiple tasks.
Do you know what's the margin of adjustment? Are people just working longer hours, or are they just working better?
So they are working longer hours. So I did a time use survey with them in the end, and they were fairly forthcoming in that sense that they don't work 8 hours a day, which is what they should be doing. But compared to control, these workers work about like 20 to 30 additional minutes a day.
Okay, so you'd say that this pushes people to work to contract, not to work above contract, which would be a bit
Yes, I mean, like there's a lot of slack before they even reach the contracted hours. Yes, this is all like pushing them towards the contract, not beyond the contract. But there is a slight nuance here, and that is when you look at these additional tasks, so tuberculosis screening and immunization camps, which is not part of their basic job description, these are kind of ad hocly added tasks to them. They still exert more effort on these tasks. So in that dimension, they do go beyond their initial, like the contract for on the job description on which they were hired. Okay, so does this all mean anything for the health of the children? And here I got a bit unlucky because this part of the paper was supposed to be based on data which was supposed to be collected in March and April 2020. And you know, that's when COVID hit. So I was in Pakistan actually, and I had trained my survey teams and everything, but the government decided that they needed to impose lockdowns and stuff. And because of that, they also, health department became unresponsive to us because they had, of course, other important things to deal with. So I couldn't do that survey. So unfortunately, these results are kind of limited, but they still, I find like something interesting here. So based on the existing household surveys that I had done, I collected information on prevalence of diarrhea. I collected information on how many children are fully vaccinated. And I supplemented this information with the data on mortality rates for children and mothers. And this data is coming from the registers of the community health workers. And combine this information in a health outcome index. And what I find here is that the mission treatment areas where the workers participated in the mission treatment actually see an improvement in the health outcomes by about 0.2 standard deviation compared to the control mean of 0. Workers who receive both mission and financial incentives also see an improvement in the health outcomes. Workers who receive the financial incentives do not see an improvement in the health outcomes significantly, though the coefficient is still, I believe, meaningful. It's just not statistically significantly different from 0. However, what's important is that the mission actually influences a broader set of outcomes. So they basically, we find that the diarrhea rates reduce, the vaccination rates increase. There is no movement on mortality, which is kind of understandable because this was a short-term intervention, and we didn't really collect this information on our own. We had to rely on the registers from the community health workers. But overall, it seems like the improvement in performance of these workers actually translates into something meaningful for the communities that are being served by these workers. Now, in the last 8 minutes, I would like to talk about the mechanism. So why do we see these effects, changes in the behavior of the workers? There are 4 mechanisms that I set out to explore. So the first is that the mission treatment may make a worker more motivated, sort of like activate something inside them, which means like they are more motivated to exert costly effort without getting a compensating financial return. So that's one, and I argue that that's the main channel through which this behavior change is achieved. The second is that maybe this led to an emergence of a new norm in the organization where workers are kind of getting influenced by their peers, thinking that, oh, their peers care about the mission, so I should also care about the mission, and because of that, I should also improve my performance. I don't find any evidence for the peer influence channel. The cynic in you may think that, oh, because this is all like, they see a video of the DHO, they talk about this mission, so they may think that, oh, my senior actually thinks a lot, like cares a lot about this job, so they may be monitoring me more. And because of that monitoring, I should be improving my performance. So in the end, I collect information on their perception of being monitored, and I don't find any evidence that that perception is different between control and treatment groups. And lastly, it could be that the mission treatment works through just providing them information. But as I showed you, that if that was the case, then in the placebo, where we're actually providing them information on how to do their job well, we should have seen some improvement in performance, and we don't actually see any improvement in performance there. So to just give you quickly the evidence on the main mechanism, which is the mission motivates workers to exert costly effort, I collect 3 pieces of evidence. So first is the stated beliefs on what do they think is the alignment between their own preferences and that of the organization. In the end line, I asked them to respond to these 3 statements, which basically kind of gets at this idea that how aligned they think they are with the organization. And the statements are something like, I like the LHW program more than other department because of the importance it places on the mission. I think the mission is very similar to my thinking, and I think if the mission was something else, I would not have been as attached to the program. I collect this information, the responses of the workers on these 3 statements, and combine them in an index. And what I find, not surprisingly, that the workers who participated in the mission and the combined sessions report higher alignment between their own preferences and that of the organization, and because of that, they are more motivated. There is no effect on the financial group because they did not participate in these missions. Secondly, if their mission treatment actually changed their motivation levels, then it should reflect in their performance, even when they are not explicitly participating in these mission sessions. So what I do is that at the end of the 3 months, I announce to everyone the workers who participate in a mission combined and the financial incentive group, that this is the end of this program. We will not be meeting again for the to discuss mission. You will not be getting any more financial incentives. So it's kind of like a very hard exit that we did. We did not just disappear. We basically announced to them that that was the end. And the idea was that if they are not motivated, they should basically, we should see a reversal in the behavior of the workers on their main job, which is visiting households. So what I do is that I'm now showing you the effect of what these workers do in this 1 month after the program had ended. And I show it to you in 2 ways. So the first way is just looking at the post-experiment relative to the experimental period, which is a simple regression in which the experimental, in which the control mean serves as the baseline. And what I find is that the workers who participated in the mission sessions continued to perform better, continued to visit more households, even after it was announced to them that this was the end of these mission sessions. We will not have any more discussions. Whereas workers who received the financial incentives, their performance basically dropped, and they basically went back to their sort of status quo performance level because they were not getting any more money for working harder. Another way to look at it is to look at the rate of decay. So like relative to the experimental period, at what rate the effect decayed in the post-experiment. And as you can see, the rate of decay for the mission sessions cannot be distinguished from zero, which means like it's a very slow rate of decay. So the people that I take that as evidence that people actually were motivated because of the mission, and that motivation is still there. It doesn't immediately disappear. Whereas that of the rate of decay of the financial incentives is almost like immediately 100% complete. The effect completely disappears. So that's evidence number 2. The evidence number 3 is 1 year after the experiment, I wanted to see whether these workers can still be willing to work harder because of participating in these mission sessions. So I elicited a BDM style incentivized activity, their willingness to work for an additional activity in a lab setting, in which one of the things, so I offered them different rates, and one of the rates was asking them to work for free, working for zero. And I take their responses to this particular rate to look at their willingness to work without getting additional financial incentives in the lab setting. And what I find is that basically workers who participated in the mission and the mission and financial incentives, they continue to have like this strong motivation to work on these activities in the lab setting without getting any additional financial incentives. Whereas people who were in the financial incentives group did not have that kind of motivation. If anything, this is kind of going in the negative direction. Lastly, in the last 1 minute, I did not tell you about one variation in the experiment in which I introduced the mission sessions in a way where in some settings people were working in groups, where in other it was all done in private with the facilitator. And the idea was that if people are getting influenced by their peers, then the response in the group work should be different from the response in the private sessions. And I don't see any difference there. So I can rule out the peer effects channel. I can also, as I mentioned, there is no difference between the treatment and the control group in terms of their perception of being monitored. So if monitoring was the main channel, then the treatment people should have believed that they are being monitored more, but we do not find any evidence there. So to conclude, basically what I have tried to argue and I've tried to convince you is that mission is a powerful motivator compared to financial incentives, and organizations can actually use it to get workers to improve performance on multiple tasks, importantly on tasks which cannot be easily contracted or measured. It also not just means that the performance improves, but it means something for the communities that are being served by these workers, as we saw an improvement in the health outcomes. Importantly, it's a kind of provides a relatively cost-effective tool for the public sector in low-income countries to get their workers to be motivated about their job and to get them to exert costly effort on their job. Thank you very much for your attention. I'm sorry I went over a minute.
Thank you so much, Yasir, for the wonderful presentation. And on my clock, you're exactly on time. So thank you very much.
Okay,
I
great.
guess what I will do is I'll turn off the recording, and then those of you who would like to stick around and ask Yasir questions are very welcome to do so.